Hello and welcome to ETHealthWorld. As we grow older, our bodies undergo many inevitable changes, but few are as quietly and devastating as the gradual loss of bone density. Osteoporosis, often dubbed the silent disease, weakens bone so subtly that the first warning sign may be a painful fracture. In India, this hidden epidemic affects nearly 40% of the women and a significant proportion of men over 50, driven by the factors like diet, lifestyle, and hormonal changes. The consequences are not just physical, but deeply personal: chronic pain, reduced mobility, and loss of independence. To understand this better, we have been joined by Dr. Rajinder Singh Gaheer, a senior consultant in orthopedics at Manipal Hospital. Welcome, sir. And in this conversation, we will delve into the realities of osteoporosis, its growing burden, and the preventive measures that can help preserve bone health and quality of life. So, Dr. Gaheer, I would like to really start by understanding what exactly is osteoporosis and why is it often called silent disease?
Right. Okay. Thank you, Rashmi. And see, osteoporosis is essentially, in a very simple term, it's weakening of the bone. See, in our bone, there's a normal metabolism where bone is deposited and bone is absorbed. So when this balance is good, then the bone strength is okay. But when the balance is disturbed, bone is absorbed more than the bone which is made, the bones become softer. If you look at a cheese, there are holes in the cheese. So as long as the holes are small, the cheese is good. So that's a good bone. But when these holes become bigger, then the cheese becomes fragile. So the bones become fragile. So osteoporosis itself means porosis. There is porosity of the bone, very softening of the bone.
Okay. So, how does it differ from a normal age related bone changes?
See, age related bone changes are very gradual. They occur over a period of time. There is no dramatic reduction in the bone strength. Age
Mhm.
related bone changes are more in women, especially after menopause, when the hormonal changes kick in. But in osteoporosis, there is a significant speed up of the whole process. So the bone become very fragile.
If you could just tell us how common is osteoporosis in India, especially among the post-menopausal women?
See, osteoporosis is now in epidemic proportions. We in India, we don't we don't look after our health, most of us. So osteoporosis is said to involve more than half of women above menopause. So in postmenopausal women, nearly 50% of women have got postmenopausal osteoporosis. And it is also neglected in men. Men assume their bones would be strong. But then if you look at people above 70 years of age, 30% of men have got osteoporosis, clinical osteoporosis.
So, if you could just highlight who is at most risk and how do lifestyle and regional factors affect this risk factor?
See, we can classify the risk factors into two broad groups. One are the non-modifiable risk factors. We are born with them. We can't change them. So being a woman is a risk factor for osteoporosis. Stature, if you're very small stature, you have a low bone mass, that your bone strength is less. Then genetics play a role. Osteoporosis is known to be more prevalent in whites and sort of people of the Indian subcontinent compared
Mhm.
to Caribbeans, Afro-Caribbeans. They've got good bone strength. They hardly get osteoporosis. So these are
Oh,
the non-modifiable. We cannot do anything about them. Then there are the modifiable factors on which we can work on. So first would be diet. We need a diet which is rich in calcium, rich in vitamin D, rich in bone minerals. Secondly, are the exercises. Our bone responds to exercises. Bone is a living tissue. So the more we exercise, the more we stress, the more it responds and builds up. So exercises. So first would be aerobic exercises where you generally condition your whole body. Then would be strength training. Strength training where you sort of load the bone repeatedly and then the bone responds. And
mm,
third would be balance training, which is very important in elderly people. If they do not have a good balance proprioception, then there is a tendency to fall. And then we see all the complications of osteoporosis, fractures and all. And then apart from diet and exercises, certain other lifestyle changes, obesity, alcohol intake, smoking, they've all been known to cause osteoporosis and weaken the bone. So we should be careful about these things.
okay. So, while you've touched upon a little, but how do osteoporotic fractures affect the daily life, mobility, and mental health? And could you also share a real life example from your practice where early intervention made a difference?
See, osteoporosis, first of all, you're at a high risk of having a fracture. The commonest fractures are hip fractures, spine, then your wrist and the ankle fractures.
Mm-hmm.
Of course, hip fractures, the general international data says if you suffer from a hip fracture in a postmenopausal period, there's a risk of 30% mortality in a year. So, that's a huge impact on a person's mortality and morbidity. So there's a risk of dying in few years. Then it affects your confidence. If you have osteoporosis, balance issues, your social life is restricted. You hardly feel like going out, and there's a risk of falling down. And if you come to a real life, I'll give you a very interesting, I've got this she's now a very close friend. So this lady, she's in her mid 50s, early menopause period. So her mother fell down at home, simple trip while going to the washroom. She fell down and she broke her hip. So she came, we did the hip replacement. She was mobilizing after that. And then when she comes to the follow-up clinic, the daughter asked, this is the third fracture my mom has had in a year. She broke her spine, she broke her wrist, and now the hip. So is there anything which I can do to prevent that? So, because she was in her sort of early menopausal period, so I did a bone mineral density, which is the one of the most important tests for detecting and quantifying osteoporosis. There's no point sort of detecting osteoporosis if we cannot quantify it. How
Exactly.
severe is the osteoporosis? So, and it turns out, she had severe osteoporosis. Her bone mineral density was less than point minus 2.7 or something. So she went on, explained all her lifestyle modifications, exercises, and treatment. So she went on medical treatment as well as the exercises. And 7 years down the line, she's touchwood, well. She says she generally feels well in herself. She hasn't had any major injuries, no fractures. She's back to most of her normal activities, and her overall well-being has improved. So that is the key. We need to be very active and have a sense of well-being when you are in your 50s and 60s.
Yeah.
That's when
Totally.
despondency comes in.
Yeah. Agreed, sir. So, what are the factors that can actually accelerate bone loss? If you could elaborate on
See, bone loss acceleration, the biggest factor I would say is inactivity.
that. Okay.
We become slaves to screens. You're sitting in front of the screen, you see kids, neck bent down towards the devices. People spend, the whole evening sitting in front of the telly watching all these OTTs. What I would suggest is go out, do some physical activity, walk, run, whatever you can, do some physical activity, load your body. Your body responds to load.
Okay.
So, so
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 since
that's
yeah.
one thing. And then, quitting smoking and reducing your alcohol intake.
So since osteoporosis has shows no early signs, how can people recognize if they are at a risk, and what age should screening really begin at?
See, that's a very, very pertinent question. It's called a silent disease for no reason. You know, so most of the osteoporosis, you do not know that your bones are getting weak unless you have a fracture. So that's why it's a silent epidemic. So the general recommendation is, if you have a strong family history of osteoporosis, then you should get a bone mineral density done. Generally, when you sort of approach menopause, around about 50 in women, and in men also, there is reduction of testosterone. So around about 60 in men is the sort of time when a bone mineral density should be done and appropriate treatment ensured.
And what daily habits are most effective for preventing osteoporosis?
Okay, so daily habits. So when you get up in the morning, go for a physical activity. And I'm always in support of physical activity. So walking, running, uh, whatever, yoga, tai chi, whatever you want to do, balance training, strength training. So that should be an important part of your daily lifestyle. Starting with breakfast, milk, dairy products. And then you have, some cereals like millet, ragi. They are very good in calcium. They're a very rich source of calcium. And then you add a few sesame seeds and almonds in it. They're again a very good source of calcium. And then moving on to the later part of the day, your food intake should have adequate protein in it. Lots of green vegetables are known to be very rich in calcium. Sun exposure is important. Your physical activity should not all be confined to a dark indoor gym, so it should also include outdoor activities.
Yeah,
And coming towards the evening, reduce the intake of smoking, alcohol, and
got it.
generally look after your diet.
Okay, so While you've kind of elaborated on the physical activity and its essential role in bone health, if you could just suggest which exercises are most effective for daily practice and what advice do you have for incorporating it into a busy urban lifestyle?
See, I generally, separate things into, so exercises. One would be your general aerobic exercises.
Right.
So simple walking, running, climbing stairs, jogging. So these are simple aerobic exercises which tone your muscles, improve your bone health, generally give you a good conditioning of your overall general health. Second would
Right.
be resistance training. So resistance training is weights. Simple weights, repetitions of weights is important. So you take a 5 pounds dumbbell and keep on repeating for different muscles. That improves the resistance training of the muscles. You can use the resistance bands. The therabands for resistance training. And the third would be balance training, where your proprioception, your balance improves, and the chances of falling, your balance imbalance improves. So that would be yoga, tai chi, doing tiptoes, standing on one leg. So these all help. They help in preventing osteoporosis and its consequences.
Okay. So, what are the key nutrients required for strong bones, and what are its best Indian-based dietary sources?
So your diet should be rich in calcium.
Mm.
So calcium is primarily, we get calcium from dairy products. So milk and any of the milk products, yogurt, paneer, chana. So any dairy product is rich in calcium. Then we come to the green vegetables, broccoli, spinach, kale, all the dark green leafy vegetables are rich in calcium. We come to dry fruits, sesame, then your almonds, they're very good. Fruits, figs, prunes, raisins, they're very rich in calcium. And then most canned fish are rich in calcium. And
Okay.
moving on to vitamin D, adequate exposure to sunlight. Egg yolk is rich in vitamin D. And again, very oily fish. Calcutta, it's a fish city. So I would presume, most of us would be having rich, oily fish in the diet.
Yeah. Okay. So, if you could tell us what measures can family take to reduce the fall and fracture risks at home, especially for the elderly population?
See, that's a very big preventive topic in current scenarios in the households. So first is, reducing the risk of falls. So there are you look at inside a house, there are so many places where an elderly person can fall. Starting from the bedroom, there's a small rug beside your bed. You step on it and you slip. So small rugs which are not secured, which do not have a non-slip backing, should be avoided.
Mm.
They should be properly secured. Then you move on to the washroom. You need guardrails to hold, not the towel rails, but proper guardrails to hold
Right.
yourself when you're sitting on the commode, when you're sitting in the bath and having a shower. So you need to get up and get down comfortably. Adequate lighting in hallways and washrooms, so that you don't trip on loose wires. So loose wires, loose articles lying around the house should be avoided. Staircases should be clear of any objects, no sort of obstacles in the stairways. So these are simple measures which would reduce your chances of having a fall.
We are kind of concluding now, and my last question to you is how can nutraceuticals like calcium, vitamin D supplements, or collagen peptides help bridge this nutritional gap that we see today?
See, nutrition, we come to calcium, vitamin D, and some collagen, which are now used for the joints and the muscles. So calcium, if your daily intake of calcium is less, so you need to have additional supplements of calcium. So that's where nutraceutical role comes in. Then there are people who are on certain medications, which increases the incidence and the severity of osteoporosis. People on long-term steroids for respiratory problems, for breathing problems, people who are on anti-cancer drugs, anti-epileptic drugs, they suffer from osteoporosis. So they should have calcium supplementation. And one of the very common causes of osteoporosis is unnecessary intake of antacids. Omeprazole, esomeprazole, these increase the intensity of osteoporosis. So if you have any issues, consult a gastroenterologist, get it sorted rather than popping antacids on your own. So these are some very important things which we need to look into.
Understood. Thank you. Thank you, Dr. Deer, for those deep insights on osteoporosis. I think we've kind of really gotten a very good sense of what are the things that we need to be careful about and what are the things that we really need to include in our diets, because strong bones are the foundation of strength, mobility, and independence. Yet they are
Absolutely.
often overlooked until the damage is done. Through
Yeah.
early screening and informed lifestyle choices and adequate nutrition, osteoporosis can not only be managed but largely prevented. As highlighted in this interview, adopting bone protective habits like regular exercise, a calcium and vitamin D rich diet, and a mindful living can help individuals stay active, self reliant, and well into old age. Prioritizing bone health today is an investment in a stronger, healthier tomorrow. Thank you so much, Dr. Gaheer, again.